So, Chairman, we're now live. Sorry, Chairman, you're muted at the moment.
Try again. Good evening and welcome everybody to the virtual meeting of the Social Care, Housing and Public Health Policy Overview Committee, the London Borough of Hillingdon. This virtual meeting is also being broadcast simultaneously on the Council's YouTube channel, Hillingdon London. I'm Councillor Ian Edwards and I'm the chairman of this meeting. For those present during the meeting and intending to speak, please note that you will be filmed and any statements that you make will be recorded and made public. Some housekeeping rules, if I may, before we start. Can I ensure, please, that everybody has their mobile phones around you that are on silent? If you're wearing a headset, ensure your microphone is away from your mouth to avoid noise. And please keep your microphone muted when not speaking. And try and do what I failed to do, which is to unmute when speaking. Only one person may speak at a time, and I, as chairman, will invite those to speak. I can see everybody on screen, and if you indicate a desire to speak, I will note it and call on you, okay? Because it's a virtual meeting, I have to go through an attendance roll call, so please bear with us. I will call out your name, and if you could just acknowledge that you are present for the record. Councillor Hina Makwana.
Good evening, I'm present.
Thank you. Councillor Judith Cooper.
Councillor Cooper has sent her apologies.
Her apologies, my apologies. Councillor Alan DeVille, I believe, is having technical problems. Councillor Tony Eggington.
Good evening, Chair. I'm present.
Thank you. Councillor Janet Garner.
Good evening. I'm present.
Councillor Becky Hagger, I believe, is also having technical problems and doing their best to join us. Councillor Paula Rodriguez.
Good evening. I'm present.
Thank you very much. And Councillor Steve Tuckwell.
Good evening, everybody. I am present.
Thank you. And can I also please invite all the officers present to indicate that they are in the meeting? Kate Kelly Talbot.
Good evening, Chair. I'm present.
Thank you. Mia Laurie.
Good evening, Chair. I'm present.
Thank you.
And can I just mention, Chair, I'm not on duty, so I do need to keep my work phone turned on.
Thank you. Yeah, noted. If we can try and keep the to the minimum, that would be great. Thank you. Is Sanita with us, please?
Good evening, Chair. I'm present.
Thank you, Sanita. Tiffany Borum.
Good evening, Chairman.
Good evening. Rod Smith.
Yes, I'm present, Chair.
Thank you. Dan Kennedy.
No, he's not here.
Thank you. Kevin Fernandez.
Good evening, Chairman and Chairman.
Thank you very much. Liz Penning, you're present.
Good evening, Chairman. I'm present.
Thank you very much. I've just had a call from Councillor DeVille, which I haven't been able to accept because we're in the stream. I imagine he's just telling us that he cannot get online, as I had anticipated would be a problem. Okay. In terms of technical meeting control, if any councillor leaves the virtual meeting partway through for a period of time, and, for example, through a lost connection, I will continue the meeting unless we are not quorum, and the quorum tonight is 5 councillors. Importantly, any councillor who does leave the meeting for a period of time will not be able to vote on any item that they're now present for, and I don't think that will be relevant this evening. Okay, details of the business to be considered today is shown on the agenda, copies of which are available on the YouTube channel underneath the broadcast. We're now going to turn to agenda item 1. We need a little bit of paperwork for colleagues, if you will bear with us, please. So we're agenda item 1, apologies for absence. Yes.
Apologies have been received from Councillor Judith Cooper, and I understand that Councillor Alan DeVille and Councillor Becky Hagger are having a few technical problems. They may or may not be able to join us. Thank you. Item 2, declarations of interest matters coming before the meeting. Are there any additional declarations, colleagues? I'll take silence as no, thank you. Item 3 is to receive the minutes of the previous meeting. That's the meeting dated the 21st of October. Are they correct, please, colleagues? Good. Silence also taken as dissent. We're now turning to agenda item 4, confirm that
everything is in part 1. There is no part 2. I'm going to make a very slight adjustment to the running order, and I apologise, Sunita. I'd like to move you back 1 so that we take items 6 and 8 together, as they are pretty common in their content, and it may be helpful to us if we consider the 2 papers together. So that with that slight change, we will be running from item 5 on to item 7. Okay, so we're now moving to item 5, which is the committee review of making the council more autism friendly. And this is a witness session. And we're joined by a number of colleagues, both officers and 2 members from HACS, who are going to here to give us some of their experiences and share with us the perception from HACS of the council. So a very warm welcome to Tony and Stephanie Mullally. We're really grateful to you for giving up your time this evening. And without the contribution of the third sector, members of the public and others sharing their experiences with us, we cannot learn to improve. And that's what the purpose of these POCs are about. It's about trying to find ways that we can become better as a council. So we really value your contribution and welcome it very much. So,
Chairman, sorry to interrupt, just one moment. I can just see somebody's joined us on the phone. If I could just check who that is. Could you just indicate who that is who's just joined on the phone, please?
Yes, it's Councillor Hagar.
Thank you, Councillor Hagar. Thank you very much for joining us.
No problem.
okay.
That's great, thank you.
Colleagues, the review paper was circulated to us, and this is now an opportunity for us to ask Tony and Stephanie to share their experiences with us. But before we dive into some questions, I wondered if Tony or Stephanie would wish to share with us just a broad outline of who HACS are, what you do, the sort of people that you represent, how many members that you have, and also just a general view and feel of the council with regards to its approach to autism. So I don't mind who speaks first. I'll leave that matter for you. So Tony or Stephanie?
Okay, Steph, do you want to go first?
You can go as CEO.
Okay. Well, first of all, thank you very much for allowing us to come along tonight. We're delighted to be part of this. HACS was founded in 1997 by parents in the London Borough of Hillingdon who had a child affected by autism. Obviously, those children have now gone on to be adults, and obviously there's lots and lots of changes. And I've seen some really good things happen over the 22 years that I've certainly been in post at HACS. We support over 300 families. In the first instance, it was just families that HACS was supporting. But as the years have gone on and our services have developed, we find also we have quite a large professional database, which is made up from teachers, SENCOs, health visitors, mental health profession. So we support a lot of people outside the family environment. We have 6 strands to our service. So we have the family support, advice and guidance, educational workshops on various topics associated with autism. We also have our employability project that we started in 2015, which is going from strength to strength. And we've also now have our adult support group as well. So our youngest client, shall we say at the moment, or from the family we're supporting, is 2 years and 8 months. And I believe our eldest client that we're supporting is 59. So you can see there's a vast range there of age, very wide spectrum, different needs. Some are associated with learning disabilities, some have additional mental health problems. So it's quite a rainbow across the spectrum of who and what we support.
Excellent, Tony. Thank you very much. Got an echo feedback. Can I ask you, please, Tony, to just mute?
You can, yes.
Thank you. Stephanie, is there anything that you would wish to add to the presentation so far?
Just to mention also that we're one of the only autism-specific short breaks providers in the borough. So that means that we provide weekend respite services for children from age 5 up to 25. There is a slight overlap in age there. So in terms of social care age bands, the young people move to the adults team at age 18. Whereas because we're working under the Children and Families Act, because we cross over with education, we actually support that cohort actually up to age 25 in terms with the newer, in line with the newer legislation that was brought in 2014. And I did note the terms of reference that had been agreed earlier before we had been part of this or had the sight of the scoping report. But I just thought it may be helpful from our background just to specify really that we do have the autism spectrum, but autism does focus on people without a learning disability. It's not categorised as a learning disability or a mental health disorder, and therefore it often falls between those two categories. So the people that we support may have an additional learning disability or they may not, and that would change the access to services they have. I know also that there's been a really historic tendency internationally to describe really able people with autism who aren't perceived to have a learning disability as high functioning. But I think when we're looking at looking to get extra support for those people, that can actually be quite an unhelpful term we hear from the autism community, and that's because it indicates that they have less support needs. And actually people with autism, their support needs are very context specific, and they may function incredibly well in one environment with the right support and actually function quite poorly without that support. So just to note that we tend to try avoid that use of language just because of the connotations that it can come with as well.
Thank you, Stephanie. That really was most helpful. And for somebody such as myself, not working within the autism field and not having family members with autism, some of the language around this, it's important for me to understand. We read different documents, we read different classifications, and labelling is unfortunately one of the things that happen. I would not have picked up on that issue around the high functioning without this sort of feedback. So that is really, really helpful, and I'm grateful to you for it. Can I just ask a really general question? And that is, without getting into the detail of the council and what the council's done, is in your journey of the 22 years that you've been involved within HACS, has the national strategy made a difference? Do you detect a clearer focus by governments, both locally and nationally, on tackling autism?
There's certainly a clearer focus, and we can see that reflected in various pieces of legislation and government papers that come out. In particular, there was huge government commitments to improve employment outcomes by 2020. What happens is we've certainly improved in the commitment, but the reality of the national picture, not thinking locally now, is that when there's been a 5-year review of the Autism Act, that it seems to be the outcomes that aren't changing at the moment. There is certainly the awareness, but not necessarily the actual support mechanisms. We're not quite there yet, but certainly on a more localised level, since 2010, there's definitely been a more a coordinated approach for us, with agencies working together. And again, it's probably important to point out that the national strategy is adult focused, but in Hillingdon it was decided back in 2010 that they would also look at focusing on children and families at the same time, and that was something that was really helpful as well.
Thank you. Forgive me, I was just jotting down some notes there because that's pretty important, some of that. The issue around awareness up, outcomes maybe not nationally. Can you share with us what your perception is of the local impact? Have outcomes improved?
I think we don't have, it's difficult to get access to the right data with autism, and that goes back again right to a census problem in terms of how autism is recorded. We know that across all services, children's services, adult services. So fundamentally, there's a problem tracking outcomes already. Many of the people that we would be looking at tracking their outcomes, they're not necessarily known to social care because of eligibility criteria, and also not known to health services. So it's difficult, but certainly on a service level, we have seen a vast improvement since 2010 in what's now available for families. But it's just there's a long way to go there as well.
Yes, I dare say that will be the case. There's unmet demand in many areas, and the challenge is always allocating scarce resources to the greatest need. Unfortunately, neither government nor local government have unlimited spending power, and the choices have to be made, and that is an inevitable. But it is really helpful to have these sorts of discussions to check whether or not we are spending local taxpayers' money wisely in supporting the needs of the wider community, which is in the interests of all of us. So that's really helpful. Can I open this now to colleagues here for questions? Councillor Makwana, Councillor Garner, Councillor Hagger. In that order, please. Thank you.
Okay, good evening. Thank you. My question is there clarity on what support services the council provide to people and families with autism and how those services are accessed?
I think there definitely needs to be greater clarity because it's not in a centralised location. We had something, the local offer I know it's currently under review. There's been work on that over the years. But I think that even on a professional level, we receive calls at least once a week from GP surgeries about how can I get an autism diagnosis in Hillingdon. And we know that there have been great improvements in the diagnostic pathways for adults in Hillingdon, particularly in the last 6 months, which I can mention a little more if people feel that's necessary. But in terms of in terms of a centralised location, getting that messaging out there, there's big improvements that we could be making.
Thank you. Councillor Makwana, do you have any follow-up questions at all?
I do, thank you. Thank you for that, Stephanie. For those that don't actually meet the criteria for specialist or statutory support, is there sufficient transparency of services available from the council and its partners?
I would go as far to say that it's not actually about the transparency, it's more so about the availability of those services. There's certainly somewhat of a silo for people that fall between learning disabilities and mental health. And that's constantly the feedback that we receive, but also it's our experience on the ground. That's our experience, and that's both at a children and adults level as well. I think, Tony, that's one of your keen area of interest that you might want to jump in.
Yes, I think if I can say, we talk about the open and the transparency, and I find with certain departments, especially across Hillingdon, what I would like to see, and there's a conversation that we were having only earlier in a team meeting, is very often that when we speak to somebody on behalf of a client from one of your departments, whether that's housing, social care, special educational needs, sometimes it's so apparent that the lack of understanding with officers that we're working with. Now, we don't expect every single officer in the London Borough of Hillingdon to have extensive knowledge of ASD. What we were saying in our meeting today, what we think we'd like to see in the council, if we were given the opportunity, is autism ambassadors, so that the council train a certain members of staff. So it could be, so for example, at the moment we're doing a completely different project search in the in the council offices. And for anybody that works within the civic, you might have seen some of my team going around with badges. They say, ask me about Project Search, because we're obviously doing, we're putting some of our young people into departments. What would be really nice would to see a handful of autism ambassadors, so where the council invest in maybe one person from each department. So if one of your offices is then dealing with somebody with autism and it's out of their depth or it's very complex, go to the autism ambassador and see if they can help, and if not, get the link back to us. We find it somewhat a bit fragmented, that the local authority are actually funding us quite a substantial amount of money through different pots and voluntary sector funding. So, you know, we are equally there to help the officers as well as helping families as well, because we're trying to get a joined up approach. Does that make sense?
It certainly made a lot of sense to me, and I really appreciate that. One of the things we have been looking at is the level of training that is provided to frontline staff, so that there is greater awareness. And it's interesting that you make that observation. Can I ask, when you talk around the frontline on occasions not understanding, and you refer to different silos, is it a case that they don't understand autism generally, or they don't understand the specific circumstances of an individual? Are you suggesting that the council isn't sharing its own information internally and people have to go through the same sorts of processes time and time again?
Yes, I would say, Ian, that people have to go through the same situations time and time again. You know, members of public are told, especially in the SEM field, tell us only once that you're joined up, so services, so education speak to social care and vice versa. But we find, especially when we're at multidisciplinary meetings on behalf of a family, that families are exhausted because they're telling the council more than once that internally there is not a joined up approach.
Thank you, and I hope Councillor Gardner will allow me to have jumped in there. Can I now bring Councillor Gardner in to ask her questions?
Yeah, thank you, Tony and Stephanie, for a really good sort of racy of what you do. What I would think that would be quite useful, which we got with TV, so having a one-door approach, because it's a bit like you said, if somebody has to repeat themselves over and over again, not only does it get tiresome, but also gets quite annoying for people. And it's a bit like, you know, how many times have I got to tell you? So I think if we could somehow arrange a one-door approach, so with perhaps an autism ambassador, go with them. So this is the situation. Also, what I wanted to ask, there are both adults and children that fall through the net because the people aren't quite sure what's going on. Now, how do you work with the schools? And also, do you work with Mead House in terms of some of the adults? Because some are deemed to have mental health problems. So I'm just trying to work out how you manage to liaise with them and if you think that the service they're providing is good enough.
We've certainly worked on case-specific cases, but that tends to be when we know that there's involvement from them. We don't really have any referrals that come our way, but that's perhaps because our adult services are still in early development. Our employability service now has been around for about 5 years, but certainly the more formal adult services where there's actually something tangible that people can access, such as a support group, such as a drop-in advice clinic, they've only been live now for about a year, and then obviously we've had lockdown, which has impacted access to that. So there's definitely greater scope for working together, Councillor Gardner, but I think it's more around the awareness of our services. And we had a phenomenal response to the Autism Awareness Day that we put on in 2019. We had something like over 500 people come through the doors throughout the day. We had all of the gave open access. Any service that felt they offered something for autistic people and their families came to exhibit what they provided and had a chance to interact with the public. We had inspirational speakers. who are on the autism spectrum themselves. That was really well received, and that went on all day. We then planned the 2020 version of that event to be very specific on engaging with the adult autistic community and their families, to say these are our services in their infancy, but we want your input to shape that service. This is what we've got on so far. So to formally launch what was initially available, but to then shape the development of those services. But sadly, that was planned for April, and that hasn't happened. So that will be on our agenda as soon as we can to develop that next year. But we have found some other more innovative ways to get that adult feedback through the lockdowns or virtually. And we're certainly starting to shape that adult support that we're able to offer.
Councillor Garden, do you have any follow-up question?
Yeah, any comment about the suggestion about the one door approach?
Yes, certainly it's something that's it's certainly something that all of the guidance has recommended, in terms of that people with autism should be allocated a key worker, that their key worker is their access to other services. I think with the vast amount of services that are involved in that, it would have to be very carefully thought out about how what that service actually looked at. But absolutely, having one door for all of their holistic needs, absolutely, and would reduce, like you say, the frustration, the exhaustion and the distress that people experience in trying to get that support. And it can be so difficult for autistic people to articulate their needs by virtue of their communication differences. So to have to articulate them on so many different levels to so many different people under pressure, unfamiliar people, that again has we think it's hard for families, it's even harder for autistic adults. So certainly that one door approach is something that I believe would be beneficial.
Thank you, Stephanie. I mean, that's really powerful and very helpful to me. Can I invite Councillor Haggard to ask questions?
Yes, thank you, Chair. Thank you, ladies, for the report. HACS is amazing, and you do so much work, which is great. I just wanted to ask you, from your side of things, how do you think it is easy for an autistic adult to get around the Borough of Hillingdon and to access things, you know, like the library? Are we autism friendly in the library? I know we have obviously the cinema with autism friendly and things like that. So one, how easy access is it to get around Hillingdon being with autism? Yeah. And two, how you think the borough has done with things like the libraries and even the parks and even in lockdown. And also whether as a borough we send out autism friendly letters. Now I know that might sound a bit, but I think you guys know where I'm coming from. A complex letter is not good for someone. The best of us at times can't understand them. So autism friendly letters, I wondered what you thought about those, and even whether we've thought about doing them. Thank you, Chair.
Thank you. Either Stephanie or Tony, come in.
Okay, Steph, I'll come in on this one. Becky, in terms of the library, I think the libraries have come on and done some really good work. I mean, I think we're blessed in this borough to have so many wonderful libraries and fantastic resources, and we've actually been working in some of the libraries, very proud to say, where the libraries was one of the very first departments to take some of our young people from the employability project, and they were so good and so open to want the training for the autism awareness that they actually offered one of our young people a permanent position there. So you know, that was really good. I think yes, the library staff in Hillingdon have had training on autism from one of our job coaches. I now believe, from my feedback from one of my team, that the libraries are very much more autism awareness. The cinema, yes, that has been very successful in the borough, the autism friendly cinemas. I think what's also been good in our local parks as well for some people with autism is the outdoor gyms. I know we've got a couple of young adults that like the outdoor gyms, and they tend to choose times to use them when they're not so busy. Also, they're free because a lot of our adults unfortunately are unemployed, so obviously that's another cost if they join a gym. So in terms of the parks, and then of course we've got our lovely rural activity garden centre, which is quite tranquil, and obviously we manage the tea rooms there, but that tends to bring a lot of our adult autistic clients down because it's quite a nice, safe environment. There's sensory things there, and that works really well. Sorry, Becky, another question. You asked about lockdown.
Yeah, I asked about, yes, that's right. I asked about lockdown and about how that was for autism, you know, and also about the letters as well, about the council doing letters. There could be autism-friendly letters.
Yes, that I think that would be something that would be very welcomed, especially again for our people with autism that have an associated learning disability, because I think you hit the nail on the head. Sometimes we can all get a complex letter where we have to read it a couple of times before we digest. That is something we have a lot of, where our autistic people come to the door. That can work one or two ways, Councillor Hagger. It can be either they turn up at the door with a bundle of letters, I've got these and I don't understand them, or alternatively, you can have an adult, where I can share with my own personal experience, is where the letters are left at the side on the worktop to pile up because they don't open them because they don't understand what they mean anyway. So yes, if we could find a way of making things more autism friendly, that would be very, very useful.
I think there could be better use of the easy read documents. There have been some very specific examples where we've worked with the Autism Partnership Board. Perhaps there's been an event, so an invitation has been, or a stakeholder consultation, and an invitation has been made in what's known as easy read format. Which is a combination, it's pictorial and more clear-cut basic language, but actually thinking about how that could be applied to everyday council services it would be a huge task. But certainly there's an awful lot of work out there already that's off the shelf ready to go. And in terms of accessing council services, I think in terms of physically navigating the borough, I think it's very difficult for neurotypical people, even where we're listening to autistic people on the ground every day, unless you experience the sensory differences and overwhelming sensory input that they can. I think it would really be down to autistic adults who are so capable of telling us that's themselves and giving us that information to think about the accessibility of venues in specific circumstances. There have been some great initiatives, things like the autism friendly screenings, autism friendly performances, also at the Beck Theatre. They have been phenomenal this year. Some of the stuff that they've been putting out there, the Beck Theatre, has been great. But I think autistic people would like more consultation about when and where those things happen. So, for example, the shopping centre, which I know isn't a council facility, they started introducing autism quiet shopping hours, which took place once every 3 months on a Sunday morning between 10 and 11. And autistic people were saying, so I can go shopping once every 3 months, and I now can't worship at a collectively universal time to worship because I need to go and do my autism friendly shopping there. So I think autistic people want much better consultation about when and where those things happen, and in what way and how they can access them.
Thank you, Stephanie. Very powerful point, well made there.
And if I could just come in there, Councillor Edwards, and say, if you see what's happening at adult social services at the moment, when they send letters out, they send them out in the easy read format, especially for people with learning disabilities. They are very, very helpful. So it would be something like that if we could consider for our adults with autism, you know, maybe using a piece of software that goes along, you know, with the visuals. I think that would be very helpful.
Thank you. Noted. Could I invite Councillor Eggington questions, please?
Thank you, Chair. Yeah, a couple of questions. I must say that I found what you've said, Tony and Stephanie, very interesting, and clearly your organisation does support the 300 families which Tony talked about. I wonder whether you've got any idea of the total number of families in Hillingdon who do have autistic adults or children, and in what way could those be supported by your organisation, be directed towards your organisation by the council once the council becomes aware of these people? So that's the first one. And I wondered also whether your HACS also supports any of the children in care, those children with foster parents or waiting to be adopted who are in the care of Hillingdon Council. Is there any arrangement for you to help there?
If I could take on perhaps the statistics and the children in care, the nationally recognised incidence rate is about 1 in 100. So forgive me, I don't know the Hillingdon estimations of populations, but if anyone out there knows the Hillingdon population, then we took roughly 1 in 100.
That's about 300,000 in total, I think.
So if we look, it is thought so though that's more so people who have been identified, and it's thought that it could be somewhere closer to 1 in 72 perhaps, but the official statistics at the moment are 1 in 100. In terms of I think there could be so much more that we are doing with children in care. The foster caring team have reached out a number of years where we've spoken at their conferences. They put on an annual training calendar where we come and deliver training for them. We've done that quite frequently in the last couple of years, but beyond the training stuff, I think there's probably a lot more we could be doing, perhaps in terms of support networks for the foster carers. Yes, I think there's certainly more we could do.
Okay. If I can just, sorry, Chair.
No.
Okay, just to add on to what Steffi was saying, Councillor Eglinton, in terms of the looked after children, we have quite a strong relationship with the paediatricians that sit on the looked after children board, and very often they make recommendations or suggestions to the parents, as Stephanie was saying, the foster parents, or the adoption panels, and we have had referrals. At present, we're just actually working with the kinship team in Hillingdon to do some work for a young person that's struggling to get a diagnosis, and also there's lots of trauma around that child. So the kinship team have reached out to us basically to ascertain what type of assessments they need to be considering for the children and for the child, and I think we're doing a very valid piece of work together there. So that's, you know, another partnership that we're pleased to say that we've been supporting.
Thank you. Could I invite Councillor Tucker, please, to ask questions?
Yeah, thank you, Mr. Chairman, and some great points that have been raised this evening. The update that you gave us, I think all councillors, all members are very welcoming of the support that you provide. I'm just interested to know, is there a requirement to do any work with schools, particularly the primary schools, and are you involved in any support for those across the borough?
Yes, we are actually. We work very closely with a number of schools in different areas where we have schools send some of their staff to us to who benefit from our workshops and our training. We also go into schools to deliver training if we're required. We've done inset days, twilight sessions, and also we support parents at annual reviews at schools, or definitely so annual reviews, or if some difficulties arise, for example, if a child's been excluded or a child's a school refuser, my family support team do attend the meetings alongside the parents to advocate with them. And we also have a very strong partnership with the Senkos and the Head Teachers Forum as well. Now that's in mainstream and special schools.
Okay, just if I may, through you, Chairman, just to follow up on The annual reviews you talk about there, I guess that's the healthcare education or the educational healthcare plans, is that right?
It is.
Okay. All right. No, thank you very much for sharing that. Appreciate it.
Thank you. Colleagues, anybody else wish to ask further questions at all? Excellent. Tony, Stephanie, what can we say other than huge thanks? Huge thanks to Hacks and the staff for everything they do. Your work is fantastic. You truly are valued. You're valued by the council for the work that you do and the support you give, and your attendance this evening is greatly valued by the committee. You've helped us understand a little bit more about where we get things right, where we can improve, and you will always be a friend of us, the council, and we wish you and your organisation continued success, and we hope that our partnership with you will go from strength to strength. So thank you very much for giving up your time tonight.
You're very welcome, Chair. And likewise, if we can also say a huge thank you to Hillingdon Council, because if it wasn't for the council believing in us many years ago, and actually the leader finding us a premises when we had to move on to Pastures New, when we had we were situated within a special school in Hillingdon, but they needed the space, so we were evicted. If it hadn't have been for the leader and several members of your cabinet, we would never be where we are today. So I think on behalf of our 300 families and all our staff and trustees, we'd equally like to return the compliment and say thank you all very much for believing in what we do. Thank you.
Exceedingly kind of you. Thank you very much. Stephanie and Tony, we're going to move on to other business. It's a public meeting, so you can remain with us, although I wouldn't allow you to ask questions. But you may prefer to do other things, and we will not be at all offended if you were to just thank us very much and leave the meeting now.
Chairman, sorry, just before we move on, Kate Kelly-Talbot is going to be giving us a bit of information about the training within the council in relation to autism. So it might be of interest to Tony and Stephanie to hear that.
Thank you.
Oh, sorry, you're muted, Chairman.
Thank you for reminding me of that. Yes, so in fact, Tony, Stephanie, can I ask you to remain on a little bit more? Because you'll hear what we've been told by officers, and you may be able to add a little more depth to that information.
We'd be delighted.
Thank you very much.
Chair.
So I'm trying to find Kate. There you are, Kate. I can see you, bottom left corner. Good evening, Kate. Over to you. Thank you.
Good evening. So one of the challenges with this, when we looked at this across the safeguarding, across the Autism Partnership Board, was that what we found was each organisation offered a very wide range of training. So there was an awful lot of training available, but it was quite difficult sometimes knowing who offered what and who it was available to. In terms of the council training though, so I'm very specifically talking about the training offered by Adult Social Care. Broadly speaking, historically, there's been a statutory requirement to offer 2 levels of training. So general autism awareness training, so staff are able to identify potential signs of autism and understand how to make reasonable adjustments in their behaviour and communication. And then more specialist training for those undertaking assessments of adults with autism that was introduced through the Care Act. And accordingly, the council do run a 2-day course. So there's a more basic day 1 and a more specialist day 2. And the training is open to adult social care, schools and external companies. As I said, there is other training available, but in terms of the training from social care, that is the basic training offer. And in total, around about 120 staff have undertaken that training. So it's been fairly well attended by adult social care, adult social work. And looking at, I did an audit ahead of this presentation, the Learning Disabilities and Autism Service, the staff had all undertaken it. There were a number of people who needed refresher training, and that has been challenging in the last few months because face-to-face training has been on hold. So the trainer has been moving from a face-to-face platform to being able to offer that training remotely and online. But I absolutely recognise that a lot of frontline staff who have contact with adults with autism could benefit from the autism awareness training. So it's something that's been done with adult social work, but there is an opportunity to roll that out much more widely. And because of that, we did develop the e-learning module, because that is a format that can be quite easily deployed to lots of people. So I think there is that opportunity to roll it out. Now, the module went live in February 2020, so obviously it's been an unusual few months with a lot of people very focused on the pandemic, but there is that opportunity to really roll that out more widely. Now, in terms of what we're doing next steps with training, in 2019 a new framework was published, which was the Core Capabilities Framework for Supporting Autistic People, and that sets out expectations around 3 layers of training. And there was also a consultation that concluded that there would be mandatory training for NHS social care workers. So the Autism Board was very much waiting for the outcome of this training to review our training offer and see to update it in light of the new legislation. Unfortunately, that has been slightly delayed with the pandemic in terms of the hearing of the bill and the conclusion of the consultation. But that's very much where we're at the moment. So we will be working through the partnership board, working with our partners, looking at how we update and refresh our autism training offer. Thank you.
Thank you, Kate. Before I invite others to ask, can I just challenge you? What are the obstacles for rolling out this training? If the package is there, what is stopping us just doing it?
It's available, it's been pushed out, there has been some publicity around it. I guess it's looking at things like, do we want to target particular departments? Do we want to include it as part of officer induction? Those sorts of issues, really. So it's there, it's available, and it has been rolled out. There has been some take up of the e-learning, but we could offer, in terms of a more targeted offer, looking at departments and council staff that we could particularly target. It is available, but there is more work to do.
Yes, you would have heard the comments from Tony and Stephanie about the awareness of some of our staff and the suggestion that maybe ambassadors would be a way of filling some of the gap. So obviously our present training approach isn't deep enough. It's not reaching sufficient people. And I know that you would have taken note of the feedback we're getting here, and that we will be acting upon it accordingly. Colleagues, anybody wish to ask questions of Kate on the training? Stephanie, Tony, is there anything you wish to say? You don't need to. I'm not putting you on the spot, but I'm giving you the opportunity if you wish to say something.
No, thank you very much for, filling us in and letting us know exactly what's happened. Yeah, no, I've got nothing further to add, Chair.
Chairman, if I could just very briefly just mention about the survey that we've conducted just before we move on to the next item. So just to advise members, we spoke about putting together a questionnaire which we would send around to frontline services within the council just to see how autism friendly they are. We have put that survey together and we have sent it around to 25 different service managers throughout the council. That was sent out a couple of weeks ago and I've been collating the responses. We've got, I think, about half have responded at the moment, so still a work in progress, but obviously as soon as we have any more information on that, we're going to put a report together which will be circulated to the committee just so we can look at where we are and perhaps some areas for improvement. So that's where we are with the survey, just to update members.
Thank you, Liz. Colleagues, let me have a quick check around the screens. Anybody wish to add anything before we move on to the next agenda item? I see nothing. Thank you very much again, Tony, Stephanie. We're now going to jump an agenda item. We're going to turn to agenda item 7, if we can, please. And this is the Carers Strategy Delivery Plan update. And that's you again, Kate. Sorry, you've moved around. Where are you? Over to you, Kate.
Sorry, good evening, Chairman. It's Gavin. I will be providing the update.
My apologies, Gavin. Please go ahead. I just got Kate's name on the paper, that's all.
That's okay. So, as a summary, in May 2020, an update was provided to Cabinet on the delivery of the Carers Strategy in 1920 and agreed a proposed approach to supporting carers over the next 2 years, pending a refresh of the Carers Strategy following the publication of the findings in the 2021 census. So the proposed approach included priorities for 2021, The report shared provides the committee with an update on the delivery of those priorities. In recognition of the extent to which the importance of supporting carers is now recognised across health and care partners and has become more embedded as business as usual, this report proposes an approach to scrutinising the effectiveness of this support going forward. So, the two primary recommendations for the committee to note this evening are firstly, progress against the carer strategy delivery plan on activity for 2021, and secondly, to confirm the reporting on the delivery of the strategy should be annual and precede the annual progress report to Cabinet. So as not to read out the report word for word, I will comment on the actions that are not paused and are on track or completed. So we have been working on the development of a guide for people who suddenly become carers, which is on track. An initial draft has been developed, and this is being further refined and should be completed by Q4. We have implemented the response to carer feedback from the CCG's October 19 AGM. This is in respect of supporting access to primary care, which is piloting a Farzai speaking interpreter in the south of the borough, where there was the greatest need. A person has been appointed on a one-year contract and they are due to start in the new year. Also, as part of that was co-designing of information for children with learning difficulties and or autism and their families, including easy-to-read guidance on accessing the health service appropriately, which is also on track. Information is available through the SEND, which is a Special Educational Needs Advisory Service. In addition, the Hillingdon Parents Forum is working with officers to make improvements to the information available on the councils for parents of children and young people with autistic spectrum disorder conditions. I will now move us to achievements between April and September 2020. Whilst the COVID pandemic has impacted on areas of development around, for example, the recruitment of carer representatives, it did, however, more broadly bring system partners together and some strong partnership working has taken place. Examples of this would be in the first 3 months of the pandemic, the Hillingdon Carers Partnership supported 134 families to receive regular deliveries of meals, the delivery of 378 food parcels, the collection of 296 prescriptions. And then we move into Q2, where £36.4 thousand in COVID grants were secured to provide the following hardship grants to 40 families with young carers, grants to 23 adult carers, and provided 22 young adult carers with laptops to support their home study. Also providing regular care calls to over 1,034 carers. The committee may wish to note that this figure may be much higher as data in the early stages was not captured. Completion of 324 emergency replacement care plans with carers to ensure that alternative care arrangements were in place if the carer was incapacitated for any reason. Then moving to council activity, carers assessments. The period from April to August 20 has seen 525 carers assessments completed, which on a straight line projection would suggest an outturn for 2021 of 1,260 assessments against a target for the year of 986. It's also worth noting that although a carers assessment is the route to directly funded support from the council, the Hillingdon Carers Partnership provides access to a range of support services for which an assessment is not required. There have also been positive increases to the carers register. As of the 30th of September 20, there were 7,982 adult carers registered on the Hillingdon Carers Partnership register. This would represent an increase of 260 on the position in April and represents 30% of adult carers against a target of 28. At the end of the review period, there were 835 young carers on the carers register, which represents 34% of young carers against a target of 28%, which again was a positive improvement. An area of focus that was identified by our Councillor Hagar, our carers champion, was in relation to carers with multiple caring responsibility. These are being identified by adult social care. The implications of these additional responsibilities on the well-being of carers are then taken into consideration as part of the annual review process. Also, strides have been made with health, GP carer leads. All 43 of the GP practices that are members of the GP Confederation have now identified carers leads in order to raise awareness amongst the practice staff about the vital role that carers have in supporting the local health and care system. It's not been without its challenges. It's worth noting that against a backdrop of unprecedented pandemic, which created unique social circumstances, a great deal of good work continued to take place under those conditions. They have not been without the challenge, supporting residents caring for family members living with dementia, and the pre-existing formal support networks pre-COVID having to shift the types of emotional support offered from a physical setting to a telephone or an online offer was one challenge that was highlighted. And my final point would be on how this report benefits Hillingdon residents. The work outlined in this report supports people who provide unpaid care and support to the residents of the borough. The proposed approach for the 2020 to 2022 period will be to continue the good work that has been carried out to date, pending the availability of the up-to-date data about how many of Hillingdon's residents are providing unpaid care and what their needs are. I will now pass back to you, Chairman, and I'm happy to take any questions or comments.
Gavin, thank you very much for the clarity of your presentation. Congratulations on that, and also for just the inclusion of the simple case studies at the end. It's always good to be able to connect with individuals and understand the impact that the work that everybody is doing is having on people's lives, and that is valued by me. And I know that Councillor Hagar, as our champion, wishes to ask some questions, so I will invite her to do so. And if others could indicate their intention, Councillor Gardner, I have you as well, and Councillor Eggington. Thank you. So, Councillor Hagar.
Thank you, Chair. I'd like to congratulate everyone first on this report. It really is good, and we've seen a massive, massive working partnership with everyone together. And it really has shown in different parties and everywhere, from hospitals to mental health, and the whole team coming together. So thank you, Gavin, for sharing that, for all the hard work that you have put in, and officers. That's what I'd like to say first. I think there's just some really good stuff in here, but what I'd like to draw attention to, I think, is Gavin touched on it at the end, actually, and the question that I'd like to ask is, obviously we have had challenges ahead. We've got lots coming up. We've had challenges during COVID. And one of the things I'd like to ask you, Gavin, is, I know we touched on a little bit, but what challenges have we had through COVID? Now, we mentioned the dementia, obviously carers that have had terminal loved ones at home. And how do we think we're going to project that for the future? Bearing in mind that obviously, you know, we're still in COVID, we're in second lockdown, and you know, what we could do about it, really. Thank you, Gavin.
Okay, thank you, Councillor Hagar. I think the learning has been, you know, so initially there was lots of rapid deployment, rapid change, a pivot of services that were being provided. And I suppose lots of work happened to engage with carers through the partnership. Carers Trust kind of shifted all of their activity to online and telephone. I suppose, from my perspective, it's just maintaining that, and it's the elements of the work, such as the multiple carers and the identification of carers. And I think it's all of the activity that we've outlined, and making sure that, you know, the kind of the salient point of the report is one of carers is business as usual, and it's not losing that golden thread through all of the work, and it's linking all of the partners together to make sure that we don't lose sight of carers. So I think that, yes, there were challenges, and I think that it was about how we responded. And I think that over a period of time, we managed to evolve and develop, and that, I think, going forward won't be, you know, we've been through it once, and I think that we're prepared for what comes after.
Thank you, Gavin. Councillor Garner.
Thanks, Gavin. Excellent report. Couple of things. A lot of people are not sure or not aware of their entitlements as their carers. Do we have a named DWP advisor who will help with carers allowance? It's basically what I wanted to know.
Sorry, Councillor Gardner, I missed the last part of the question.
Do we have a named DWP advisor who would help with carers, getting carers allowances?
So yes, so we have sources of information, and we absolutely, yes, is the short answer.
Probably the same sort of information I've got as well. Thanks.
Thank you very much. Councillor Eggington, and then I'll come back to you, Councillor Hagar. Thank you.
Thank you, Chair. Yes, an interesting report, definitely interesting, and a lot of work has been done. I was wondering, Gavin, what do you see after assuming that COVID is over next year and we're able to get vaccinations, what do you think are going to be the greatest challenges for supporting carers in 2021-22? And how could that be supported or dealt with?
I suppose, in my humble opinion, so I suppose without kind of going to a focus group and wider discussions, my humble opinion is I think there's an element of work around, so the people that became carers during lockdown and how we draw those people out. And I think it's a whole systems approach. It's making sure that our district nurses, our community matrons, our care connection teams, the PCNs, all of our allied health colleagues, our social workers, all of those touch points in the community. I think for me, it's about making sure that nobody's left behind from the lockdown periods.
Thank you.
Thank you very much. Councillor Hagger?
Yes, thank you, Chair. Just to come back on Councillor Gardiner's question, because I think that was a really good question. And one of the things we have done at Hillingdon Carers is I was trying to look in the report actually, Gavin, and I couldn't see it. It might be in there somewhere. Was actually how much they have secured within the Department of Work and Pensions. So basically, like you say, Councillor Gardiner, you know, a lot of carers do struggle to get their benefits and come in completely, and we recognise that. And I can't remember the figure, but we can go back and find it if that's okay, Chair. But there is of how much has actually been secured through the Department of Work and Pensions by Hillingdon Carers. I don't know, Gavin, whether you could remember the amount, but there is an amount that's secured.
Thank you. There's no expectation that officers will have grasp of every detail at these meetings. If the committee wishes to know the exact sum of money, we can ask that afterwards. And if that is the case, Councillor Liz Penny will contact you. But just hearing that there is that expertise and advice, and that people are being referred, and that we are being successful in gaining access to these allowances is, I believe, very helpful to us all. Councillor Tuckwell?
Yes, thank you, Mr. Chairman, and thank you for sharing the report this evening. One of the areas I'm interested is, and one of the actions which is listed as completed, is supporting carers in the workplace with local businesses. Just wondering if there's any feedback we've had from businesses, big, medium, and small, in terms of how they're able to support carers to fulfil their very important need in the community. So I'd be just interested to hear if we've had any feedback and there's any further support we can give the business.
It's a good question. I don't have any feedback, but that's something we can follow up on.
Thank you very much.
Follow up.
We will ask you to follow that up, please, then, if you could let us know, that would be most helpful. Councillor Makwana?
Thank you, Gavin, for this report. My question is around, obviously, the COVID restrictions meant that a lot of the respite or the breaks were provided virtually. How were these received by our carers? Thank you.
So, yes, so respite services were provided and feedback has been positive. I suppose it's subjective. I think for some people it was positive because they were still receiving support. So probably further feedback needs to be sought. So I wouldn't want to kind of say the ad hoc bits of information that have been shared with me have been positive.
Thank you. Again, I think that would be helpful to understand a little bit more about exactly what we did do to support respite during the COVID period. And if it was done virtually, the extent to which that was successful, and whether or not there's learning about that as an approach to provide a lower tier of respites as part of our everyday business in a virtual way. That may provide some assistance to us. So if you could just update us on that one, Gavin, that would be helpful.
Absolutely.
Colleagues, are there any other questions on this agenda item? Okay, no, thank you very much. Thank you, Gavin. Thank you for your presentation. You may leave the meeting. There's no requirement for you to remain. However, you may also remain and listen in if you wish. We turn back to agenda item 6, if I may please now, and this is Sunita with the online housing benefits application. Sunita, if it's okay with you, if you could just present the paper. We won't at that point take questions. I will then ask for the presentation of the paper at number 8, and we'll draw together the questions across the 2, if that's all right. Okay, so Sunita, over to you to introduce paper at number 6.
Okay, thank you, Chairman. Good evening, everybody. Back in March 2020, I was asked to present a report in respect of the online services for housing benefits and council tax reduction. However, due to the pandemic, this was postponed. The report presented as agenda item 6 contains the original report drafted back in February 2020, and the addendum attached captures the impact of the COVID-19 pandemic on the benefit service from the 1st of March. I would just like to give you a brief overview on how benefit online services operated prior to the pandemic. The benefit online facilities were first launched for new claims back in 2017 and was then fully rolled out in May 2018. So this service and council tax reduction online 24/7 at their convenience. The move to the online service makes it easier for residents to make applications and enables them to receive their initial payments faster. This was also brought in as part of the national shift towards claiming benefits online, which includes the rollout of Universal Credit. Since the move to Universal Credit in October 2018, the majority of new claims for help with housing costs are now made through Universal Credit, which is a single monthly payment and has to be applied online. Help with paying council tax is not included in the Universal Credit claim. These claims have to be made directly to the local authority. With regards to our online facilities, the benefit service provides support for people who do not have access to online facilities or need assistance to make a claim. We have 11 computers available in the benefit reception area in the Civic Centre and 4 computers at the one-stop shop in Hayes, as well as libraries across the borough. Benefit staff are also available to provide face-to-face help at the benefit reception area in the Civic Centre and at times at the one-stop shop in Hayes. The data presented in the original report is for 6 months from the 1st of April to the 30th of September 2019, and online how many visits either the Civic Centre or the one-stop shop to access our facilities. The Civic Centre accounted for over 95% of these visits at an average of 130 people per week during this period. The second table shows how many applications were received and were submitted successfully online during this period. It also outlines the volumes of applications received prior to the COVID pandemic. The last table in this report details the average processing times in respect of the new claims and reporting changing circumstances. The data presented in the addendum is for the 6 months from the 1st of March to the 31st of August 2020. Due to the COVID pandemic, council staff were advised to work from home in line with the government guidelines on essential travel. This caused face-to-face activity to be delayed and benefit reception to close temporarily. Customers were advised to go online or to phone the contact centre. Vulnerable customers that were unable to complete the online forms were advised to request a paper application. The benefit reception remains temporarily closed to avoid unnecessary physical contact. Demand continues to be managed successfully through our online and phone contact. Where someone insists on a face-to-face meeting, we have accommodated them, but this has only happened once, with all other contacts being successfully dealt with via other channels. Between the 1st of March and the 31st of August, the benefit service received in excess of 10,000 emails and over 22,000 telephone calls. The data presented in the first table shows that out of the total number of applications received during this period, over 82% submitted online successfully. We received 453 paper applications during this period. These make up 13% of the total number of applications received. When compared with the period between the 1st of April to September 2019, you will see that there has been a substantial increase of over 60% in the number of applications received. This is again has been caused by the ongoing COVID-19 pandemic. The percentage of applications submitted online successfully fell slightly in comparison to the previous period, while the number of paper applications are on the rise, in the main due to the benefit reception being temporarily closed. In spite of increased volumes and adapting to the new working conditions, the benefit service has seen a substantial improvement in processing times for both new claims and changing circumstances. It has been identified that home working has been a major contributing factor to this improvement. So I've just given you an overview of the reports that were presented in respect of our online services.
Thank you, Sunita. And as I said, I'll take questions after we hear from Rod's paper. But your briefing there was most helpful. Rod, if I could invite you, please, to introduce paper 8.
Thank you, Chair. Just by way of a reminder then, this is really an update report to committee on the position regarding universal credit in Hillingdon. If you recall, quite an extensive review took place in 2019. The review included a number of witness sessions and a number of witnesses. And I think, without putting words in the committee's mouth, I think there was a general summary that preparations were quite well advanced with the council and its partners. Really, what the committee wanted to focus on, and what's been reflected in this report, is the strengthening of our collaborative work, issues around lack of access to ICT and concerns around basic skills, processing, procedures and signposting for residents, and awareness or increasing awareness of debt management, and a reflection of training and training needs across the council and its partners. And just at the end, we've provided a short summary as well, which you probably expected to see, about the impact of COVID-19 as well on universal credit. So just a bit of a summary there. We did receive feedback from a number of our partners, and we've tried to reflect that under the various headings. Obviously, they're not here tonight, but certainly I can take anything away in terms of any queries and try and answer anything that members have. And just at the end, there's a couple of charts there, really for my service area, which I'm happy to take members through or answer questions on, just to give a bit of a reflection of how some of the numbers changed over the pandemic, and particularly the first quarter of the year.
Thank you, Rod. What I picked up from both of these papers was the challenge thrown up by COVID and the response of the council and its officers into finding new ways of working to meet the needs. And I must say, I have been impressed with the outcomes that have been reported here, in that the workload hasn't buried the staff. They have risen to the challenge. They have delivered a turnover of caseloads with the same resources that maybe we would have felt unreasonable to have asked if we had suggested we would double your workload without increasing your staffing. And it has surprised me, and it is really warming to see how professional and responsive the officers have been to this challenge. And they need to hear that from us, to say thank you to them for showing that innovation and that commitment and that drive to rise to the challenge presented by COVID. And it's also indicated to me that there are learnings, and that maybe there are ways that we might enhance or change our service going forward to deliver the efficiencies that maybe we wouldn't have identified but for the challenge put in by COVID. It wouldn't have been a particularly wise experiment to have run, but it is one that has resulted in some fantastic learning from my perspective. Councillor Tuckle, you indicated a desire to ask questions, and Councillor Gardner. So Councillor Tuckle, please.
Yeah, thank you, Mr. Chairman. A couple of points I wanted to pick up on, but firstly, just wanted to echo your sentiments there about, you know, how impressive the numbers that are contained. I'm talking about agenda item 6 now, Sunita. So the numbers that are contained, particularly in agenda item 6, you know, unprecedented situation that we find ourselves in. But I'm looking at the two tables where we're looking at the amounts of claims that have been processed, and I look at the first table and we're looking at 22.7 and 26.4, and then I turn over the page and see that despite the increase in claims, you've actually improved the processing time significantly.
Yeah.
So a massive thank you to your teams for managing that, and our residents as well. The massive improvement. I'm just really interested to sort of know what your views are and what's underpinned that.
Okay, I'm going to hand over to Tiffany, because Tiffany's my operational manager and oversees the processing team. And if, Tiffany, if you could add a few words to that.
Hello. Yes, I'd just like to say thank you for your comments to start with. I am really proud of the service and what's been achieved over the last, I don't even know where we are now. What has it been, like 9 months, I think? It has been so challenging, but I think, you know, we have sort of organised the teams. They've all been successfully working from home, which, you know, we actually, just before COVID hit, we were actually piloting home working with 2 members of staff, and come April, we had almost all of the officers working from home, which was, well, like you said, if you'd have asked us to do that with a month, you know, notice, it would just not have happened normally under normal circumstances, but everyone just had to pull together and make it work. But we have very much focused on priority work. We've also given extra training to staff. This all happened as well just at the end of a restructure that we'd had. So we also, I think, had managed to promote some people into the right roles, and maybe that gave them, you know, more of a push to want to work harder. We've also been able to automate certain processes during this time as well. So our systems team have worked extra hard in automating some of the universal credit notices that we get, which is a huge volume of our work now. As obviously you all know, lots of people have gone on to claim universal credit due to being out of work. So I think it is a mixture of things as to how we've been able to, you know, achieve the results that we have. We've had so many more claims than we would ever have expected. Like I said, our restructure was done based on, you know, a sort of a steady move onto universal credit, not an avalanche onto it. And the you know, result of the huge increase in council tax reduction claims that we've had. We've been very lucky. We've had nobody that's been affected by COVID within the team. We've had very little sickness as well, which I think is possibly down to home working. So, you know, that hasn't impacted us. I wouldn't say we have a huge amount of sickness anyway, but, you know, generally there are people throughout the year that will be off. You might have a few long term. I think that has really gone down as well. So, you know, overall, I think everyone has just really risen to the challenge. And, you know, we do recognise that as well within our team. So we do praise people, we do give regular updates on how we're getting on, and sort of give people a challenge as well as, you know, can we clear this? We have blitz days. So we really just try and get everybody involved in sort of where we are, and recognising that, you know, we're there to support the vulnerable residents in the borough.
Tiffany, well, I just would like to congratulate you on your leadership then. You managed to bring this enormous increase in productivity through to your team. That needs to be passed on, but particularly thanks to you. Councillor Tuckwell, back to you. If you have further questions.
Oh, thank you. Yeah,
videos of everybody. I don't know if you turned off your videos, but you're all disappeared. It's just Tiffany and I at the moment.
Oh,
I was still here, Chairman.
Carry on. I don't know what's happening with my technology, but
okay. Well, if I may ask a couple of questions in relation to agenda item 8, but thank you to Tiffany for sharing your thoughts there. And it's in relation to, was Rod mentioned, the strengthening of collaboration, and again, you know, what was the success behind that, because that seems to have yielded a positive result for us here.
Absolutely. I think the focus quite rightly is on universal credit and assisting people to claim universal credit at a particularly difficult time. But I think the reality is, at this particular time, just getting somebody onto universal credit isn't the total answer, and hasn't been the total answer. We've still been dealing with vulnerable people with a range of underlying issues. We've still been dealing with people who were in debt before the pandemic struck, were in arrears before the pandemic struck. So the approach really has been to strengthen the need to wrap support and tailored services around people, which includes sorting out their financial issues and money matters, and supporting them to manage their universal credit claim, not just get onto universal credit. Manage their housing costs, manage their utility payments at a time when people who have been, shall we say, in secure employment up until recently, who have lost jobs and lost pay. So really it's been around making best use of our partners, best use of our resources, to enable some people perhaps focus on the universal credit side, when we've been assisting people with accessing medical services, mental health services, and a range of other services, really to support families and individuals. So it really has been a joint effort.
Okay, I've got no follow-ups, Mr. Chairman, but thank you, Rod, for your responses.
Thank you very much. If I could invite Councillor Garner to answer questions, and as I say, colleagues, I'm very sorry, but I've lost video connection with all of you, so I cannot see who's indicating for ask questions. So it's now going to have to go over to verbal. So Councillor Garner first, please.
Chair, sorry, can I just, before Councillor Gardner speaks, would it help if I just tell you who else has raised their hand to speak?
Yes, please.
Yeah.
That would help.
So if I just tell you now, Mayor, did you have your hand? Do you want to speak? Because I saw you indicated earlier.
Yes, I was just going to add a little bit more on what Tiffany said. So I don't know whether you want me to do that now or not.
Yes, please, Mia. If you come in now before Councillor Gardner, that would be helpful. And
okay, well,
it's as we'll do a double act between myself and Councillor McWiner is to try and call a running order on this one. So Mia, over to you.
It was just to build on the point. I think the initial question was about from Councillor it was Councillor Tuckwell, wasn't it? How have we managed as a service to achieve the improved performance at a time where the workload has increased so dramatically, and at a time where you have the pandemic affecting every part of the organisation? Well, there's a number of points to that, some of which Tiffany has covered, but part of it, the benefits service, when the pandemic broke out, I think it was about half of the benefits service didn't actually have a laptop. So a key part of it was other services that I'm responsible for had to hand over their laptops literally on day one, and they had to then be, so the other part, like internal audit, counter fraud, became office based using desktops, so that the laptops could be handed over to the benefits staff. And so part of what we've seen there was not just the team spirit across the benefits service, but across the entire council, that you know, you go back to the points earlier in terms of Stephanie, I think it was, when she was talking about the autistic paper in terms of joined up approach. We were one council and have showed that during this pandemic we have been one council. Benefit service working very closely with housing as well during this period. So I think when the laptops were handed over, the benefits staff very much thought, actually we've been given an opportunity to work from home here, and my take on it at my level is there's a lot of staff in the benefits service, if not all of them, that were putting in an awful lot of extra hours, unpaid hours, to get the job done, because it was, you know, that kind of British mentality in a real time of crisis. Everyone was really putting in the role to make it a success, to do their very best, because there's a lot of vulnerable people out there trying to claim universal credit on benefits and what have you. And I think, as you rightly pointed out, I think Tiffany's management and leadership of the team, with Sunita overseeing it, a lot of credit to the pair of them, but also I think the staff across the benefits service and across the organisation really collectively came together very positively, and I think that's what's contributed to the massive increase in performance.
Yeah, I'm grateful for those comments, because it is without the colour that you bring in with the just the transference of laptops between members of staff, that supporting each other, that I hadn't realised went on, and it is valued to see the one council coming together, and the focus being supporting residents, that those that needed help got the help, and they made sure that happened. That is really warming, and I'm confident that all members would be saying thank you to everybody for having done that, and it's a message that needs to hear. I know that the leader constantly is thanking staff, but it's, again, you need to hear those voices from us as well. So, Councillor Gardner, you have the odd person is popping back up, but I only have 4 of you present. So, Councillor Gardner.
Yeah, first of all, agenda item 6 and agenda item 8 are quite welcome. And as you know, for the review in 2019, I was incredibly sceptical about how we roll out universal credit. And what actually I am heartened by is, we used to do our surgery at the one-stop shop in Hayes, and I saw how helpful the staff were there, helping people do their benefit forms. And I thought, when the COVID hit, we couldn't do our surgeries anymore. That was it. People would be struggling. It's absolutely fantastic to hear what you've been able to do. You know me, Rod, I don't often throw compliments out, but I'm actually very impressed. So thank you to all of you.
Okay, Councillor Maguire, is anybody else indicating?
Yes, we have Councillor Eggington, and next after is Councillor Hagger.
So, Councillor Eggington, please, and then after that, Councillor Hagger. Thank you.
Thank you. I was going to ask a question of Rod Smith regarding universal credit. I believe that the managed migration at Harrogate, which is the trial, has been suspended. But I also saw reports in the press that in the first 6 months of that managed migration in Harrogate, that is from the historic benefits through to universal credit for existing claimants, that only a very small number, less than 20 cases, had actually been migrated out of a total of 10,000. It seems to suggest to me that the managed migration is not going to happen in the near future, or even in the medium future at the rate it's going. Do you have any thoughts about ways in which, well, presumably you've done a lot of planning on the basis that this was going to happen in Hillingdon. It doesn't look as though it is, and does that create any problems for us?
You're probably right. I think there will be delays in terms of problems for us. I don't think it presents a problem. It probably presents an opportunity to learn from the experiences that we've been through. If we scratch around for any positives from COVID-19, probably one of the biggest positives is the stress testing that we've been through over the last few months in relation to the pandemic. Our ways of working, our different ways of working to meet demands, meet workloads, and to support residents. So I think we've learned a lot, we've changed a lot, and if the route moving forward is a slower but steady increase of universal credit claimants, then so be it. It certainly won't cause us a problem, and if anything, it will probably support us in supporting our residents.
Thank you.
Thank you. Sunita, you've very kindly used the raised hand icon. Is it a comment that you wish to add at this point?
Yes, I'd just like to add, first of all, I'd like to say thank you very much for all your kind comments about the service. And I just wanted to pick up on the migration of universal credit. Hillingdon was due to roll out, or should I say due to migrate, or the existing claims were due to migrate over to universal credit, and that is the housing benefit of migration of claims. However, I understand that has been delayed. It was supposed to happen this month, but because of the pandemic, I believe that's going to be pushed back.
That's welcome news for me. It sounds as though the staff are coping with an tidal wave of demand at the moment, and to heap further change on them would be a real challenge. So I think the pause is helpful to us. Councillor Haggard, can I invite you to your comments, please?
Thank you, Chair. It is a really good report, and it's great to see how we've managed in a crisis. I think congratulations to all the team involved. It is a team effort, and congratulations to everyone who's really been hard at work. And it is about pulling together. I like what you said, Rod, actually, about everyone coming together, but particularly about the vulnerable people, because they are the ones that get missed. And I suppose my question, and it might be very difficult to answer actually, but my question is, do you think, because obviously there's been so people's jobs have gone, etc., etc. But when we're looking at particularly the vulnerable people, do you think we've actually missed anyone or been able to not contact them? And how I mean with that, I suppose, is that we know that it's the vulnerable people that never actually complete the forms or realise they've got to do anything. Yeah. And especially in the pandemic, they might well be at home and have not been out since March. But it was just a question, and I didn't know how we saw that, whether we think we might have missed any areas, whether we'd even know, and also what the future might look like too. Thank you, Chair.
Thank you. I can't give a guarantee that we haven't missed anybody, but possibly we're in a unique position in the sense that the people that don't come forward in one of my service areas are often evidenced by arrears of rent accruing, and that provides an indicator to us to start to engage with them and support them. The other early area of intervention is that we need to verify all universal credit claims on behalf of the DWP. And those claims obviously increased significantly. We were talking about 30 a week, when at one point we were jumping to sort of 250 a week. So one of the biggest ways we were supporting residents was to turn around those claims in line with our service timetable, 5 days, and we did that 100%. And that was the hard work of our revenues and charges team. That was the only team that was working from home. As a landlord service, we didn't have the luxury of all working at home. We still had people with fires, flood, and all sorts of other things, which you can't do from your living room at home. So, but that particular team were working at home. They were working 7 days. They were working over the Easter bank holiday periods because the DWP were as well. So they were pushing out their verification requests morning, noon and night. And our staff were working on a shift rota basis, again, 7 days a week, and they met those demands. So those early indicators of non-payment of rent, the early indicators of a verification claim coming through enabled us to be more proactive. And we essentially became a reverse contact centre. Rather than receiving calls, we were just on the phones all the time, contacting people, and that worked very, very well. Thank you.
Thank you very much. I seem to have just about everybody back now on the screen, which is really helpful. Anybody else have any other questions on this item? No? Then I just want to wrap up by saying that colleagues, those involved in the work behind papers 6 and 8, you're an absolute credit to the authority and are your teams. The way you have shown innovation, the way you've stepped up to the challenge, the way you have supported residents that are facing some really, really challenging times when they need to be put onto benefits. And your ability to turn that around speedily brings so much comfort to them. And you are an absolute credit to the authority. So thank you for your work. I appreciate it very much. Okay, colleagues, if I may, Liz, we're now turning over to agenda item 9.
Yes, so agenda item 9 is just the forward plan, which is really just for information for members. And if anybody has any comments or queries on that, then they can raise them. No, doesn't look like anybody.
Thank you. Noted. Great. We know.
Okay. And then, is it okay if I move on to agenda item 10?
Yes, please. Yes, please.
So agenda item 10, Chairman, is just the work programme, and I think there's nothing really on there particularly to add. It's all fairly self-explanatory in terms of what's coming up in the next meetings. We don't actually have a meeting, as you well know, in December, so the next meeting will be January the 19th, and I believe the idea then is to hopefully we'll have the results of the survey, which will have been communicated back to you all from the autism review, and then we'll have an opportunity to think about the findings of the review so far, and to start putting together some ideas and recommendations. So that's really where we are with that. Has anybody got any comments on that at all? No, it's fine. Okay, so that's, I don't really have anything else to add on the work programme. Thank you, Chairman.
Right, that brings us to the end of the meeting, and I cannot believe that here I am on the 26th of November about to say something like, I might not see some of you again until the new year. Have the best Christmas that you can, because our next meeting is not until January. We're not around the Civic Centre too much, and we may not bump into each other virtually. If not, yeah, have a good new year, and we'll see you back in January. So thank you very much, everybody. Cheers.
Okay, if you could all just remain on mute just for a moment, and I will stop the streaming. Thank you all.
Yeah.